When support becomes silence, the hidden impact of nurses eating their young. Today, I want to talk about something we don't always like to admit happens in our profession: nurses hurting other nurses. We call it nurses eating their young, but the research calls it lateral violence. As someone preparing to enter the workforce, this topic hits close to home. I've heard the stories, the warnings, and the sarcastic good luck comments. Even without experiencing it firsthand, it's clear this is a real ongoing issue, and the evidence shows it has serious consequences for nurses and our patients. As a student nurse, I feel nervous about entering a unit where I'm not supported, or worse, bullied. Nationally, this issue is part of something even bigger. A 2025 Journal of Nursing Management study shows that toxic peer behavior and poor psychosocial work environments are major drivers of burnout and turnover. With the current staffing crisis, the way nurses treat each other isn't just a workplace drama. It's a national healthcare problem. Unfortunately, lateral violence isn't rare or limited to one type of unit. A 2024 cross-sectional study found that horizontal violence scores were above the medium level among nurses, meaning this isn't a minor issue. Other research shows it's more common in high-stress settings like ICUs, emergency departments, and operating rooms, but no unit is immune. It's a cultural problem, not a unit problem. One of the strongest findings across all 5 studies is that lateral violence is a powerful predictor of burnout. The Vital Alves study showed that all forms of coworker violence, personal attacks, social exclusion, and work sabotage significantly increased emotional exhaustion and cynicism. The 2024 psychological detachment study found the same thing. Horizontal violence has a strong positive correlation with burnout. So, when nurses say, "I'm burnt out," we need to ask, are they burnt out from the job or from the way they're treated by coworkers? Often, it's both. One of the most compelling findings is how lateral violence affects us after a shift. The 2024 detachment study found that nurses who experience hostility at work struggle to mentally disconnect when they go home, something called poor psychological detachment. Nearly 45% of the relationship between violence and burnout was explained by this inability to switch off. So even on our days off, even lying in bed, the comments, the gossip, the humiliation, our brains keep replaying it. This makes recovery almost impossible. There is something that helps: a strong sense of professional mission. The 2024 study found that nurses with a deep sense of purpose and calling were much more resilient when experiencing lateral violence. For nurses with a high professional mission, the connection between horizontal violence and burnout became non-significant. It doesn't mean the behavior is okay. It means purpose can act like emotional body armor. But we shouldn't rely on nurses having to tough it out. The Vital Alves study used a structural equation model to look at both user violence, meaning violence from patients and families, and co-worker violence together. The results were clear. Both forms of violence significantly predicted worse mental and physical health. Nurses exposed to coworker aggression reported higher anxiety, more depressive symptoms, more somatic complaints, and poor overall health scores. And again, emotional exhaustion was the strongest mediator. Lateral violence isn't just a nurse problem, it's a patient safety problem. The 2025 Frontiers in Public Health Review showed that burned out nurses have higher error rates, reduced vigilance, and poor communication. The 2022 Workplace Violence Study echoed this. Violence disrupts cognitive focus and decision-making, which directly affects care. So, when nurses treat each other poorly, patients don't get the care they deserve. All of these studies pointed to deeper systemic issues that allow lateral violence to continue, like a culture that normalizes tough love or hazing, oppressed group dynamics within nursing, leaders who stay silent or avoid addressing conflict, chronic overload, and staffing shortages that make everyone short-tempered. This isn't about mean nurses. It's about systems that create pressure, foster competition, and fail to protect staff. Based on the studies, here are the most effective solutions we can implement. 1. Leadership that actually responds. Zero tolerance for bullying, real consequences, real support. 2. Build a culture of psychological safety. Encourage speaking up, remove sink or swim mentalities, train charge nurses and preceptors. 3. Support emotional recovery, protected time off, reduced after-hours communication, and stress management resources. 4. Strengthen professional mission, mentoring, recognition, and opportunities for growth. 5. Fix workload issues, safe staffing, fair assignments, and adequate support, because burnout can't be solved without addressing workload. To close, lateral violence is not just a part of the job, and it never should be. The research shows it's widespread, harmful, and deeply connected to burnout and poor health, but the evidence also gives us a roadmap for change. With the right leadership, healthier cultures, and genuine support, we can create environments where nurses lift each other up, not tear each other down.